Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, September 20th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, after last week's message focused on the Social Security windfall elimination provision and government pension offset and the ongoing efforts in Washington, D.C. in terms of pushing forward with a discharge petition that would force Congress to vote on these issues this year, we want to refocus this week and shift gears and go back to talking about healthcare, specifically the notion of whole person health. Now, this is a term that you may have read in our newsletter. You may have heard us talk about on videos like this or in our teletown hall meetings or our area meetings. You may have heard our friends from Blue Cross and Blue Shield talk about it, or David Morales from WellPoint, or Matt Vino from the GIC. Whole person health is becoming an increasingly, the focus on whole person health is growing across the whole healthcare marketplace. But what does it mean? That is a frequent question that we get from members anytime this term is used. Well, what is that? And it's also a question that we ask healthcare providers. What is it? How do you define it? And most importantly, what is it in practice? How is it going to improve the quality of care being provided to our members, and ultimately the quality of life of our members? Now, traditionally, healthcare, at least as it's been delivered through healthcare and health insurance companies, has been focused on what David Morales in one of our town halls referred to as sick care. So in other words, we get sick, we get hurt, something happens to us. There's an illness or an injury that requires us to seek medical care. That's the traditional approach to healthcare. And that's not changed, or has not changed. That's an extremely important part of what all of these companies do, provide excellent healthcare services to public retirees. But the focus on whole person health goes a step further than that. Looks at the big picture, if you will. What is it that's making us sick? Why are we ill? How did we get hurt? What improvements can be made in our communities and helping to improve the quality of our lives that are going to lead to better health outcomes, a better quality of life for all of you. At the same time, these initiatives are also designed to naturally either cut down on or reduce in some fashion the growth in healthcare costs. It might not cut costs, but it's at least going to slow down how quickly healthcare inflation is beginning to accelerate once again. The old approach to these types of things were simply to cost shift or reduce healthcare services. And study after study has shown that that's the wrong approach. It may produce some short-term savings when you pass the costs on to retirees, but we now know the long-term impact of that is negative and actually not only harms the quality of life of retirees, but also costs the overall system more money in the long run. So whole person health takes a step back. It focuses on the overall healthcare picture of enrollees, and whether it be an enrollee of Blue Cross or WellPoint or the other health insurance companies here in Massachusetts. One example of whole person health that is now being up and running or utilized here in Massachusetts is something called place-based supports, known as PBS, not the public broadcasting system that we may have all been familiar with, but a program. This particular program, as it's being administered here in the greater Boston area across our senior housing sites in the greater Boston area by Molina Healthcare and an initiative of Molina Health called MolinaCares Accord. And that's in collaboration with an organization known as the Senior Whole Health Initiative. These initiatives are focused on the application of whole health at the senior housing level. And this is bringing in a variety of services beyond traditional healthcare, which again is being provided, but it takes a step further. The various services being offered are healthcare education, wellness programs, recreational activities, adult learning, meals, after-hours emergency response, a variety of initiatives to bring healthcare to seniors living in senior housing. instead of requiring them to go somewhere else and maybe come into Boston to access services, these services are meeting people where they live in their communities and in their own homes. And the idea here is to have a positive impact on the quality of life of retirees living in senior housing. Now, Molina Health is specifically geared toward folks who are either dual eligible, so whether it be Medicare and Medicaid together, or on the Medicaid side. So for the most part, our members are not financially eligible for the services that are being directly provided through Molina. However, we do know that we have a growing number of members who are dual eligible for both programs. We also know that we have quite a few members who are caregivers or care providers in your own right. So whether it be aging parents, whether it be siblings, friends, other family members that you are the caregiver for, who might be eligible for these programs or in some cases may already be enrolled in these programs. So we believe that this is something that is useful. It's just useful knowledge to know what's out there. And at the same time, we're going to be hearing more and more from the Blues, from Wellpoint, from the GIC and the other providers here in Massachusetts who are going to be rolling out additional whole health services and programs through these different insurance companies. So we believe that this was a good case to show you a tangible example of what this would look like in terms of the actual application of whole health. So for our members, look to today's email message that came out at 6 a.m. this morning. You're going to find additional information about place-based supports as well as whole person health within the email, along with some hyperlinks for you to get more information. There's a great video that's linked on our YouTube and Facebook page today, as well as within today's email message to give you additional information on the MolinaCares Accord, senior whole health, and so forth. So with that, thank you again for tuning in. We'll be back to you again next week with a new update. In the meantime, be well, everybody.